My name is Terry Trulove, and this presentation is an introduction to pharmacology, and it's designed for the learner who is brand new to pharmacological concepts. The first question is, what exactly is pharmacology? Pharmacology is in fact the study of drugs and the interactions that those drugs have with living organisms. Pharmacology encompasses a diverse list of interrelated topics, including but not limited to some of the sciences, such as botany, chemistry, genetics, and toxicology. In addition, there are other things to consider when discussing pharmacology. These include things such as addiction and abuse, government legislation, including the politics that are associated with that legislation, and patient education. Where does the word drug come from anyway? Well, it's actually from a Dutch word named droog, and which means dry. And this refers to the first uses of dried plants as a way to access chemicals that would be used as medicines for the human body. The Latin word for drugs is medicina, which means remedy or cure. And all of these refer to a medication, a drug, which is administered for its value. And the value comes from whether it is preventative, whether it is diagnostic, or whether it is in fact a therapeutic agent. There are three medical uses for drugs. They can prevent disease, they can be used to diagnose disease, and they can treat symptoms, basically signs and conditions of the disease itself. Let's look first at preventive use. And in the illustration behind me, this is a child who's receiving a vaccination to prevent one of the many childhood diseases. The term prophylaxis comes from the Greek to keep guard before, and we consider these preventative, preemptive medications as prophylaxis. We might use prophylaxis before traveling as a way to prevent motion sickness. We may use prophylaxis, as shown in this illustration, as a vaccination before illness, or we may use prophylaxis as a way to prevent contraception as birth control. We can also use medications for diagnostics. We can use contrast dye during an X-ray procedure, as shown in this illustration here. Another example would be medications such as a medication called persantine, which would be used to increase the heart rate. And this is when we want someone's heart to have more exercise. We want more out of the heart, but perhaps there's something in this patient that doesn't allow them to exercise, like get on a treadmill or walk up a flight of stairs. We would still need that information on what happens to their heart when their heart is given extra work. But we couldn't do that in a traditional way of giving them on an exercise device. So we would give them some sort of medication that would increase their heart rate, increase how much their heart has to work. And by doing this, we can induce perhaps symptoms or conditions of the disease we're trying to either identify or even treat. Then we have therapeutic use. And here we have a medication called levothyroxine, which is used for people who are not making enough of their own chemical called thyroid. Thyroid is very important to metabolism, and it is a critical component. People who aren't making enough thyroid simply will not do very well. Examples of other ways that we might treat, that is, to lessen conditions or symptoms, include analgesic medications to help prevent pain, your headache medications you might have taken even this morning, perhaps medications to lower cholesterol or triglyceride levels, or even antibiotic medications that are used to prevent bacterial or viral infections. This slide is here to demonstrate that Western medicine is not the only source of these medications. And in this example, we have traditional Chinese herbal medicine. And in fact, in 1970, the Chinese Academy of Medical Sciences found that about 45% of Chinese traditional herbal remedies were therapeutic, according to the standards set down by Western medicine. Pharmacology has been around for, as we understand it, thousands of years, and there is archaeological examples from way, way back of perhaps people getting things like the foxglove plant when they noticed that their ankles were more swollen, and they understood that by making a kind of tea or a soup out of this foxglove plant, if they took it for a few days, that some of that swelling around their ankles might go down. And in fact, for others, they were having difficulty breathing. And after drinking a tea made of the foxglove plant, they started to feel better. They breathed easier. Well, now we know that within that foxglove plant is a chemical, and that chemical we have named digitalis or digoxin. And it is, in fact, a medication used to treat heart diseases. If you come across a term called pharmacopoeia, a pharmacopoeia is a list of all of the drugs used in the apothecary, the individual ingredients of those medications, the strengths and the purity of those medications, and even how to prepare them. And in this illustration, we have an example of a mortar and a pestle. And these are used to crush the dry ingredients in preparation for humans to consume them. Now, in around the 1800s, chemists first started extracting important substances from different other things. Most of them were plants. One that comes to mind is from the poppy plant, ironically, the state flower of California. Although you should know it's a different type of poppy that produces the medication called opium. Opiates, or opium, are widely used as a very powerful form of pain control. Pharmacists no longer prepare the medications the way they once did. Mostly they assemble them, they make sure they're at safe dosages, etc. But there's really not the old school pharmacists who are the ones with the Bunsen burners and the test tubes that were carefully extracting the chemicals that they needed out of these plants and other substances. Nowadays, that's done by chemists, and the pharmacist is more relegated to the direct actions with the medications themselves.